Since April, 44 people in Texas have died from the disease, 7 of them children. Now, some parts of the states are being overrun by people who are sick. So one hospital has taken an unusual step to treat this new wave of patients. CBS News correspondent Teague has the story.
If there was a question whether the H1N1 flu would hit hard in Austin.
He's got a cough right now.
We're going to put a mask on him, okay?
One look at the emergency room at Dell Children's Medical Center provides the answer. Doctors here are seeing more than 200 people a day for flu symptoms alone. So many sick children, they've set up a flu triage outside the ER.
This area will be used to treat very low acuity patients and try and get them the evaluation and care that they need and get them home.
Inside the tents, patients are checked for symptoms, tested for flu, and treated with Tamiflu if necessary. Doctors at this hospital made the decision to set up these tents last week when computer models told them their flu situation was about to get much worse. The triage takes pressure off the primary ER, getting help faster for kids with flu symptoms.
I think it's wonderful. They're having an overflow and trying to deal with the best they can.
How long will the tent stay? Doctors aren't sure, but say flu season here hasn't peaked yet. Teague, CBS News, Austin.
Joining us now from Austin is Dr. Pat Crocker, Chief of Emergency Medicine at Dell Children's Medical Center. Good morning, sir.
Good morning. How are you?
This giant influx of patients, are they real patients or is it panic?
No, we have seen a large number of patients, and most of them actually meet the CDC criteria for treatment and evaluation.
How sick are they? Do they, by and large, require hospitalization?
Well, no. And the nice thing we've learned about the swine flu virus is that it seems to be a mild to moderate flu. Most people really don't even need to see a doctor. We're starting to see a very small increase in the number of flu-related hospital admissions, but it's not been with critically ill patients.
And as best you can tell with this giant influx, who is getting sick? What demographic?
So far, about 75% of our cases have been in children under 14 years of age. And we're just starting to see a few cases in the older population.
And among these kids, how much worse is it if they have an underlying condition like asthma or something like that?
Well, that's one of the key indicators of somebody at high risk, and that's somebody who's under 5, over 65, or has some chronic condition like asthma, lung disease, diabetes, or pregnant.
And this is very early in the season. How much do you suspect these tents are really going to fill up in the weeks to come?
Well, we're concerned about what the volume will be, and we can scale this up. But I think we're just at the very front of this, and it will probably take 4 weeks to peak.
Wow. Dr. Crocker, thanks for your time, and good luck, sir.